Hello, my name's Tom. I'm based at PHIRST South Bank. I'm here with James Grimes of Gambling with Lives to talk about the different forms of impact in public health, the different forms of lived experience impact in public health research and practice, looking at the case of gambling-related harms. Okay, so just to set the scene, obviously, gambling-related harms is increasingly being recognised as a major public health issue. The harms are multifaceted, ranging from individual health impacts, impacts on families and the wider society at considerable social cost. Yet the actual national public health framework for gambling-related harm is underdeveloped in England, and there's been a kind of historic role for the gambling industry in the funding and delivery of health promotion, prevention and treatment services, and increasing recognition that is quite problematic in terms of the content of educational campaigns and treatment services and so on. And also, partly because of that historic role, there's major gaps in the public health evidence base in terms of actually preventing the harms from occurring. So the project, the local partner is Greater Manchester Combined Authority, who has sought to initiate a community response to gambling-related harms, exploring this with a view to raising all awareness and prompting action through a community of practice. So core research questions for the evaluation: how, for whom, and in what context does a community of practice facilitate understanding and action on gambling-related harm? But with a really important question, which is, or objective, to assess the potential of lived experience to be actively involved in regional gambling-related harm reduction efforts and local interventions. So one of the things that the local partner has really prioritised and done is involve lived experience in all stages of development and delivery of this project in really interesting ways. And one of the things that we have sought to do in the evaluation is to assess the potential of that. I'll stop sharing there. It's great today to have James with us, who has been heavily involved in this project really from the start. James, do you want to give a bit of an introduction to yourself? And yeah, interested to hear how it all began for you.
Yeah, thanks, Tom. I'm James. First and foremost, I'm someone with lived experience of gambling harm. I had a 12-year gambling addiction, which started at 16 and finished at 28, but lucky to still be here because sadly so many don't recover from gambling addiction. Into my recovery, I founded a campaign called The Big Step to try and get gambling advertising and sponsorship out of football, and also became part of Gambling with Lives, which is a charity representing families bereaved by gambling-related suicide. And that was 4 years ago. And at that stage of my life, I was just James, the recovering gambling addict. And I had these big ideas, but didn't have the skills. I'm not from a public health background, that's for sure. I thought all I had was my lived experience, but I've actually come to learn that I can be involved in quite a lot. And it's been really helpful for my recovery. All of the work that I've done in my recovery has been mutually beneficial. It's helped my ongoing recovery, but also my recovery helps me do the work too, which has been really important. And I got involved with GMCA right at the start of this process at a conference. I was sitting on the table with a guy called Simon Watts who started this whole process, and he asked, how should lived experience be involved? And at that moment, I said, at least listen to our views and get us involved from the very start. And that was the seed of GamHive, and I've been involved with that from the start up until this point too. And yeah, I've had many hats on during this process.
Thanks, James. You said, yeah, really listening to that seems really important to that. And can you give us a sense of how they've listened, what they've kind of acted on, your advice on?
Yeah, I think that's the key point of it. It's never been for me just listen to your stories and think, oh dear, that's really sad, but we won't do anything about it. Actually, there's been a real, how I see our input into this, which has been really useful, is like a critical voice, and a voice on the ground from people that know what it's like to, be warned about gambling, try and access treatment, to be involved in policy change. All of those things have come through us, and we've provided, well, I hope we provided a critical voice. And that's not always the case. I'm involved in other lived experience advisory work, and obviously involved in other organizations in this space. And a lot of lived experience involvement is tokenistic and box ticking. This, I can honestly say, hand on heart, has not been that. And that's a credit to GMCA, to Joe Evans in particular, but everyone involved, because we've said things and then seen things change the next time we meet that person. And I don't think you can ask for much more than that. Our views have been reflected, which is great.
So you said your many hats, you wear many hats, and one of those is with Gambling with Lives. And so that is one of the 12 community organisations who are involved in the project, and actually that educational intervention is lived experience led and informed, and it does something very different to the existing educational interventions, I believe.
Yeah, so gambling education in this country is still relatively new, and it doesn't come with much of an evidence base, but actually it's entirely dominated by organisations and materials that are funded directly by the gambling industry. We, as Gambling with Lives, are not. We have no partnership or influence by the industry at all, so would say that we are completely independent of industry influence. But it's not just about the relationship with the industry when it comes to education. Actually, what we do is we try to shift the narrative, and a lot of the focus in not just education but general prevention efforts when it comes to gambling are about individual responsibility, and it being up to young people to safeguard themselves from addictive products. We see it the other way around. We think it's up to governments, local authorities, regulators, the industry to protect people from harm caused by the product. So we of course don't rob agency from young people, and we try and give them the tools and the information and the hope and the help for if they do ever struggle. But we do also say that there's a reason why this is happening, and it's down to addictive products, mass marketing, unsafe practices, loose regulation. And we've been piloting those materials over the last year, mainly delivered by people with lived experience, which has also been quite powerful. And you can see when we're delivering it, there's moments, young people are young people, and when you first go in, they're like, oh, what's this, another talk about something we shouldn't do. But then when they recognize one of us in the films that we've got, the penny drops, and they realize, this is someone that has gone through this is someone that has lived this. Actually, that's when you have their attention.
So that's James, with your educational hat on, with your GAM Hive as well, because that message of we need to move beyond individual responsibility messaging. There's a increasing evidence base as well, suggesting that those kind of health messages are potentially stigmatizing, but also counterproductive. You're actually adding to the information cues in the information environment to actually consume more. And one of your messages as a GAM Hive was to actually develop social marketing messages that did something very differently.
Yeah, so a lot of the messaging, once again, preventative messaging is dominated by the industry. It's basically owned by the industry. Like when the fun stop is the one that people may recognize. That is industry led. We, as GAM Hive, got the chance to input into what you can now see, which is the Odds Are They Win campaign. And that, for the first time, I think, was quite pioneering in that it took a completely different approach, and it flipped it really to really get to the truth. And that the truth is that gambling harms a lot of people, and that the harms are widespread. And actually the fundamental message that I think I needed to hear at 16, 17 years old was that the gambling industry makes £14 billion a year. It does not do that by making lots of winners. Actually, 99% of the customers lose. The other 1%, by the way, get their accounts restricted or closed down. This is the industry you're up against. It's very, very, very hard to get what the adverts pretend that you will get out of that. So this was massive for us. And when it first came to us, it wasn't perfect, and there were a few problems. In all honesty, when we first received it, we thought these were gambling adverts. We didn't get the distinction. But it was another example of them really listening, because they came back with what you can see now.
Could I ask whether being involved in our evaluation as well has been interesting, helpful, or whether you've taken anything, or perhaps not?
It's been great. I'm not just saying that because you're on screen, Tom, but it's been really helpful. It's helped me really understand what public health interventions are like and how you measure whether they've been successful or not. These were all words that were not in my radar 2-3 years ago. So it's helped, and it's also helped me with the other projects I work on. So I talked about the education program, in that we are shaping our theory of change and what impact we want to have. And these engagements have been really helpful, but also you just feel more, worthwhile. You feel like you're being actually consulted on things, and there's times where I can see my words being reflected in material. That's always a nice feeling for someone with lived experience. So it's been another, really good example of engagement.
Just to reflect and finalise, we think there's a range of impacts on the research. So likewise, James, it's been great to work with you, because you brought that big picture perspectives, really, and that's kind of enriched my understanding of the sector. I moved in to, I didn't have the previous understanding and experience in it, so having you there to provide that big picture. I think as academics sometimes we specialize a lot, and we kind of lose the big picture. So that's been really quite helpful for us, and we've drawn upon you as well as two other people with lived experience who sat on our PPIE panel, and that was really useful at all stages of our evaluation, from research design, developing topic guides with you and Colin, through data collection, analysis as well, involving you in that to really quite kind of draw out the themes and help us understand what the data is saying. It's been really helpful. So there's that, the impact on the research, impact on the people with the lived experience. So when you were talking there about actually how it had been intertwined with your recovery, and also your current journey in developing your career, and actually there's lived experience organisations, as you know, that are there to help public health organisations actually facilitate this. And then of course the impact on society, bringing in people into being involved in research without that formal training with James, for example, and also we haven't discussed this, but I know GAM Hive really achieved a lot of diversity and put a lot of emphasis on ensuring that diverse communities from around Manchester were represented, and also tied into some of the community organisations who were working with different ethnic groups to raise awareness and sharing those lived experience stories. And so that's certainly an impact on society there. I think the key question is, how might this good practice in the gambling harms field be emulated in other sectors? And as part of that, I think in terms of our first research centres, whether interventions should be prioritised really for evaluation that have PPIE and LE embedded and really are taking it seriously, like Greater Manchester Combined Authority in this case, or if this is something that we really need to be working with local partners to develop. I think that's a key question.